Dr. Sam Berne, welcome to the Sports Doctor.
Thanks, Dr. Bob. Great to be here.
Give us some background on yourself, and you can throw in a definition of holistic optometrist while you're at it.
Sounds good. So when you go for an eye exam, the doctor has you read the eye chart and you get the reading 20/20. That's a measurement of your eyesight. But vision is how the eyes and the brain and the body work together. So eyesight is only one part of vision. So as a holistic eye doctor, I look at the eyes as an interrelated, interconnected part of the body. And there are things that you can do to improve your vision even as you get older. And that's kind of the difference between the regular eye care. They just say your eyes get worse as you get older. In my practice, people get older and their eyes get better.
That's exciting. We featured for years on the Sports Doctor, Dr. Sam, hand-eye coordination, all sorts of eye exercise, sports optometrists talking about enhancing performance regardless of the sport. And there's a lot of exciting information in that side. Besides the run-of-the-mill eye care, like you said, there's so much more involved. Even as a diagnostic tool, I know, like podiatry, where many times we might see diabetes for the first time because of a foot symptom, you also might see it when you see changes in the eyes, right?
Well, exactly, because the eyes have one of the highest metabolic needs of the body, highly concentrated with those tiny blood vessels. So it's one of the entryways into the body, like the foot, and you can pick up disease very early. And of course, in diabetes, this is a real vulnerable area. I'm talking about the retina. So, if you have glucose levels that are off the charts or you're pre-diabetic, you're going to see it in the eyes. It's going to be one of the first places, and then you can treat it by doing some holistic things if you want to.
Well, you talk about embracing your body's ability to strengthen healing balance. And again, we talk so much about holistic medicine, what a complementary medicine on so many different topics. And this sounds like this fits in absolutely with a big emphasis on prevention as well as awareness and education.
It's being proactive. Just with diet alone, the eyes and the brain make up about 2% of the body weight and use 25% of the food intake. So if you cut out processed foods and sugar and mostly gluten, and you eat, the colorful vegetables and berries, get enough healthy fats in your diet, that in itself can keep your eyesight healthy and well as you get older.
It's so common to see children at younger and younger ages routinely with glasses, although glasses now are styling, in some ways. But do you feel that there's the introduction of corrective eyeglasses too early, or are we really paying big attention to prevention?
Well, when you get glasses as a child, what it's doing is it's reinforcing the problem that's causing the need for glasses to begin with. So, again, back to the holistic perspective, I find the cause and treat that. And we know that the eyes originate from the brain. And so if you do eye exercises, not only are you changing the brain, but you're also changing the eyes. And of course, the other thing that's going on with kids is screen time. So the more screen time they have, this is really wreaking havoc. And then with COVID, where schools were just online, I got so many complaints from parents and kids about eye strain, eye fatigue, red eyes, blurred vision, dry eye, and so on. So I think the screens are another factor we have to look at in terms of helping kids improving their vision.
Factor. The whole mental health angle in so many different ways, in all ages, it's the biggest topic. It's interesting, no matter where my guest is from, whatever their vocation is, from anywhere in the world, everybody's concerned about mental health. And social media is such a challenge, to say the least. And again, the screen effects on the eyes and whatever, that's got to be a whole new world, I would imagine.
Well, more and more research is coming out about the damaging effects of the artificial blue light. It's a chaotic frequency, and first of all, it messes with our circadian rhythm. If we're staring at a screen after 6 p.m., suppresses the melatonin, as you know. But it also can dry the eye tissue out, and in severe cases, it can start to cause things like macular degeneration and cataracts. So we need to protect our eyes.
That's one of the reasons I wanted to have you on. We need to pay attention
Mm-hmm.
to that, as well as, you talk about the eyes in the brain, We feature so much information on the sports doctor, on the world of concussions with experts all around the world. Want to get one of your perspectives. When we come back, everybody's talking, everybody's sports doctor. Go to my website, sportsdoctorradio.com. If you go over to radio shows, you can go back years, all sorts of topics, local guests, national guests, international guests, endless array of topics. Listen to whatever you would like. If you go over to newspaper articles and magazines, great information, a lot of excitement with MVP Parent Magazine, a lot of excitement. The upcoming documentary where our children play, the whole world of youth sports. We have thousands and thousands of followers. And you can follow me at SportsDoc, DOC Radio, on Twitter. I can't tell you how many guests we get from Twitter and LinkedIn over the years. We're speaking with Dr. Sam Berne, the holistic optometrist. Again, behavioral eye health. I wanted to ask you, Sam, again about your thoughts with the world of concussions and the whole eye connection.
So I've done research and published on traumatic brain injury and vision. I've also worked in hospitals, written articles. It's a huge problem today in sports. I mean, it's not just the NFL, but what happens is when we get hit in the head, it reverberates into the nerves and muscles in the eyes. Now the problem is we don't pick these up on an MRI. So you've got these soft symptoms like blurred vision, double vision, memory issues, balance issues. You know something's wrong, but the traditional eye exam misses it. So when you go to somebody like me, we're testing things like visual tracking, visual focusing, visual reaction time, peripheral vision, depth perception. And we're looking at how the visual system has been impacted. And then once we get the diagnosis, we can do physical therapy on the eyes to repair the damage that's occurred from these traumas, concussions, and so on.
Yes, just last week we had Mike Pia. He's the CEO of HitCheck, which is it's an app, a system of having a baseline available for any particular athlete, whatever the sport happens to be. So if there is an incident involving head trauma, they can have something to look at. And again, this idea of the whole eye effect. What's the best website for information, Sam, on you, your writings, and your whole world?
DrSamBerne.com. I have thousands of videos that are free on there, also written blogs. You can also find me on Facebook and TikTok, Twitter, Instagram, LinkedIn, and YouTube. I do tons of...
It's everywhere. You know, what's interesting, Dr. Sam, is
Yes.
when we talk with optometry and eye experts, ophthalmologists, again, high performance. I had a whole group of race car drivers talking about their hand-eye and their vision training. But the idea of eye protection in youth sports, I would think was not paying nearly enough attention to that. What are your thoughts?
Oh, I totally agree. I mean, I think when you get hit in the eye, it really causes a lot of problems. You know, circulation issues and double vision, blurred vision. You've got to use protective eyewear, especially with kids and they're playing in contact sports. It's a no-brainer. You know, we recommend it all the time for people.
It's amazing. The three words I stress all the time on the Sports Doctor for decades is awareness. We're talking about what are we talking about? Your education regarding learning about the topic, whatever happens to be, and then positive action. And this fits right smack in the middle of that when you think about the vast majority of kids, regardless of the sport, where they're running and jumping and doing all sorts of things, I just don't see many goggles unless there's someone who wears glasses and then they get maybe prescriptions or whatever. Are we making progress there?
I think a little bit, especially in sports like lacrosse and squash and racquetball. But, in basketball or football or baseball, no, I don't think we're making enough inroads there. You're right, it takes education and being proactive. And, we need to do a better job of PR, getting that stuff out there.
And again, like we were talking the term baseline, having a baseline, like you talked about, the kind of visual analysis you might be doing to establish these different connections, again, eye, brain, etc., all these different effects, and being able to have that as another one of the baselines. So if there is, again, some sort of trauma, and again, concussion is a gigantic concern, all sorts of questions, when is it safe to go back? We've come a long way, baby, but we still have a long, long way to go. That might be another idea for your world, which is having that baseline available for athletic directors and or coaches. Hey, did we start a whole new thing or what?
This starts another protocol. We already have the concussion protocol. Now we need to bring the vision piece into it. And that could actually be part of the baseline and whether or not, when an athlete can actually go back into competition.
Again, like you said, getting older and a lot of the changes and the eye changes and a lot of the different concerns, and the idea that, again, the eye exercises should be a routine part of what we do. And man, that's another real challenge. And that with the different eye specialist optometrists I remember seeing in the past, I don't know if I ever had anybody talk to me about eye exercise.
We don't really emphasize it in school, but in my own vision, I had very bad vision when I was a child. I was very myopic, and I met a doctor who did this physical therapy, and I completely reversed my myopia. I don't wear any glasses 30 years later. So I'm a living example that you can do it. And the eyes and brain have a plasticity. That's the thing. And if you offer them new experiences, new pathways, you can improve your vision. And I think it's coming more into things like occupational therapy, physical therapy, in some of the private schools, in sports. But I think in regular eye care, we're so geared towards looking for disease and using pharmaceuticals and drugs and surgery that there's no place for exercises.
Yeah, God bless America.
Yes.
That's always been one of the challenges in so many different areas, which is, you have American medicine, which is a pill, surgery, doctor visits, and then you have the whole Eastern holistic world. Years ago, we would talk about acupuncture, we would talk about mindfulness, mind, body, and medicine didn't know how to spell it. I think they've come along. How does the general medical world pay attention to your perspective regarding eye care, or the optometry and ophthalmology world, Dr. Sam?
Well, I think it's slowly changing because in the grassroots, the patients are asking for it. And because there's so much emerging in the area of nutrition, functional medicine, acupuncture, as you say. By the way, many of the meridians in the body go to the eyes. And so liver, gallbladder, those affect the eyes quite profoundly.
Tapping,
yes. Emotional tapping. That's
ETP.
Yes.
We feature a lot, again, those points to make positive changes in the body. It's funny, years ago they would say alternative medicine. And now we go, would start more arguments. So somebody, they said, hey, what about complementary? And I think, that makes so much more sense. And again, in the area of high performance, I think, again, that this is something that seems to be paid more and more attention, thinking about that guy in the batter's box or whoever's hitting a ball or moving in different directions. The whole eye acuity, these are things that can really be improved, can't they?
Oh my God. I've worked with baseball players, golfers, volleyball players, wide receivers. You know, it's all about reaction time, keeping your balance, tracking the ball while you're, you know, up in the air. So there's no question that sports vision is a huge, you know, it's a huge support for athletes that want to, you know, play at a higher level.